Good morning. Good afternoon, everyone.
Hello, good afternoon.
Good afternoon and welcome to the COVID-19 Learning Community Meeting, hosted by the COVID Command Center and powered by the Joint Information Center. By default, all participants will be muted to minimize distractions. For Q&A, please use the raised hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and remute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions and comments into the chat panel. Please hold all questions and comments until after the presentation portion of this event. Our meeting objectives today are as follows. To review the current state of the SF pandemic and local indicators of hospital capacity, disease situation, and disease control and current pop-up testing efforts. To review the right to recover funding mechanism as a way to enable isolation for those found to have COVID-19. And to describe the community hub supported by the Department of Children, Youth, and their Families, also known as the DCYF. Our agenda today is as follows, and I turn it over to Joffrey Morris for a welcome and intro.
Good afternoon, everyone. Today is going to be some exciting things and a really exciting time to find out about learning hubs. You all can see my background. I am also one of those parents that are homeschooling an 8-year-old. So definitely excited to hear what DCYF as well as the Right to Recover. We continue to do these events because COVID continues to impact our most vulnerable populations and disenfranchised communities. And through these meetings is how we know we are sharing with community providers and stakeholders what is happening at the CCC. So please, again, continue to share and forward this email to as many people as possible, because this is where we give you all things COVID. We've changed the name of this event to community learning because you learn also where the hotspots are, but new policies and programs that are coming out based on COVID-19. Thank you all. Chad in the Right to Recover. Chad, we are excited to hear about the program Right to Recover. I understand it's some limitations, but if you can just share with the community about how this program started and anything that's happening.
Yes, so hello everyone, my name's Chad Houston. I work at the Office of Economic and Workforce Development on the workforce side. The Right to Recover program came about from the UCSF study that I think just about everyone has heard about on the call, where it highlighted the high rates of COVID of the Latino community contracting COVID-19 and the access to really needing financial assistance so they can safely isolate and quarantine. The program was launched on July 1st with an initial investment of $2 million, and it offers minimum wage for individuals to safely isolate and quarantine who contract COVID-19, which is $1,285 for the 2-week period. And to keep it low barrier and serve the communities that we want to serve, we ask a simple question. Well, the Department of Public Health asks a simple question during their intake interview for folks who contract COVID-19, which is, do you need financial assistance in order to safely isolate or quarantine? If they say yes to that question, they then get sent over to us to connect them to the program. And we work with 4 community-based organizations, which are Meta, YCD, Hospitality House, and Self-Help. And well, 3 out of the 4 organizations have a large Spanish-speaking capacity because we are noticing folks who access the program, about 70% have been preferred Spanish speakers. And so when we really set to do this program, we wanted to specifically target folks who do not have access to a lot of the kind of stopgaps that were given from the CARES Act, such as, you know, extended paid sick leave, getting the check, which was the extra, what would you call that? The stimulus payment, yeah, and unemployment insurance. So the folks we were reaching were undocumented workers, gig workers, individuals who were formerly incarcerated and just didn't have access to a lot of those stopgaps. And so I'm going to, can I share my screen? Yes, here we go. So with the program, we're gonna serve a total of 1,500 individuals. Checks have gone out to 975 individuals, and of those, 71% have a preferred Spanish-speaking language. We do not get detailed, like further details of like race and ethnicity and age, because we wanted to keep the program low barrier. So we're just asking for folks' address, as well as their address, where they live, and then we see from the Department of Public Health their preferred language for when we give them a call to make sure we are communicating with folks properly. And so, as you'll see, the highlighted areas, which is, here we go, 94102, so far, we've served 80 folks in the Tenderloin, 146 folks in the Mission, 178 in the OMI area, and 172 in Bayview, and 85 individuals in Viz Valley. How do I stop sharing? Did I stop sharing? I can't tell. Oh, here we go. Yeah. So those are the communities we've reached. We're looking to get the remaining payments out the door by the end of next week. The program has been, unfortunately, exhausted. We're looking at ways to fund this program further, because we see that it is reaching the communities that we intended to serve, and that it is a vital resource that we've gotten feedback that folks really need, because it's a tough time right now. And so, yeah, I'm open to taking questions. I know folks might have had some questions I heard about process, but that's just a quick overview of the program, the outcomes that we've seen thus far, and yes, opening to any questions that you all may have.
Joy has a question saying, how long is the process from referral to payment? And was employment status a factor?
So we do not ask folks if they were employed. It's just asking, and the reason we don't do that is because then we'd have to verify employment, and we wanted to keep the program low barrier, and that would add to the process as well as timing. But I think it takes away from low barrier if we're trying to go and verify employment. So employment status is not a factor. And from referral to payment, originally, so I'm going to back up, because if someone tests positive, they then get an interview with the Department of Public Health. And And that timing, I can't speak to as much, but from the referral, because we've gotten a lot of questions from how long it takes from testing positive for COVID-19 to receiving the referral payments, but it looks to be about 2.5 weeks right now. Originally, when we wrote the program, it was in June before we had an uptick in COVID cases. So the turnaround was about 5 days from referral to check out the door. Now it's closer to 2.5 weeks from referral to check out the door. And we are not accepting currently new participants. So we're on our kind of last leg of folks who tested positive in August that we're getting out the door now.
As you said, you're looking for additional funds. Here's the question is, are you having a wait list in case funds become available? Because I know funds have been deleted.
So the Department of Public Health stopped asking that question. Folks reach out to us directly asking about the program. What we're doing now is directing folks to a list of additional resources through HSA, who we partner with with our workforce hotline, because that's where most of the questions that we get come from are the workforce hotline, as well as our workforce email. So we direct folks to other resources. We are looking at, since there's going to be a gap on if we continue the program, and we're still figuring out if we are continuing it, and we hope it continues. But since there is a gap, we will work with the Department of Health to look for people who asked for resources. And by that, I mean connected to housing, connected to food security, those type of resources, and see the folks who are the most vulnerable and see if they need to be connected to the program should we start this program up again.
I don't see any hands in. Any more questions for chat? Oh, Uzuri.
Yes.
We can go,
Yes.
Uzuri.
Okay, so maybe I missed the memo. Did you let all the CBOs know about this program?
Yeah, so the Department of Public Health, I know, did a lot of outreach for the program. The Office of Economic and Workforce Development, I believe, told our partners about the program. But as far as outreach for the Department of Public Health, I can't speak to as much. But I know I can tell you that we've gotten a lot of community feedback with probably over 1,000 emails in the last month, 1,000 emails and phone calls from folks who want to participate in the program. And we try to connect those individuals as well, but most are coming through the Department of Public Health because we need to confirm, in fact, that they did test positive for COVID-19.
Right, so then that's another, okay. Okay, thank you.
Thank you.
Can you also, Chad, go back to your community partner slide so people can see the community partners you did work with? Did you have a slide for that? I thought I saw.
Is that self-help credit union, or is that self-help credit union or self-help?
That's self-help for the elderly.
Okay, got it.
And let me share my screen. So we worked with Hospitality House, Meta, Self-Help, and YCD were the 4 orgs involved in distributing funds to these, to 777.
So one question is that, can we get access to that spreadsheet being referenced? Like, is your slides available for people, or are those your personal slides?
Yeah, if folks want, so not access to that working sheet because it is a working sheet, and it'll have that information is just changing rapidly. It's going to be different tomorrow, or different by Monday. So if folks have questions about distribution and outcomes and such, they can email me directly, and I am putting my email in the chat.
Okay, great. Okay, and so Michael, so the funds are out. You're just doing the last payments, right? For the last people that were approved. Is that correct?
That's correct.
Okay, and then Dr. Fuchs, you can ask your own question.
Yeah, I was just curious, I'm interested qualitatively, did people express concern that other benefits might, if they receive benefits, that they might be jeopardized in any way if they took advantage of this program? That was the first question. And the second, actually just related to that, is did you hear from people that in fact, because they got these funds, that enabled them to be able to stay home and self-isolate? Like, how effective do you think it was? And I'm just curious how you learned that.
Yes, to the latter, we'll have some data at the end, because that's one of the questions we asked. Would you have tested for 2 questions? Would you have even gotten tested if you didn't know the program existed? And would you have safely isolated or quarantined should you have not had access to the payments? We're seeing for sure yes to the second question. We're waiting for more feedback to get a more thorough answer to if they would have tested in the first place, if they knew the program existed. And I'm sorry, what was your first question?
I'm just curious if people were reluctant to accept the benefit because they thought maybe that by getting it, it would impact their ability to get other benefits that they're eligible for.
So that wasn't a common question. Folks did have a question around if I have other benefits, but it wasn't very common. It was few and far between.
Thank you.
Okay, and the final question comes from Mike. Is there going to be a push to get more funds to give to SF so that we can keep the right to recover going?
Yes, I know they're exploring it through both philanthropic dollars and the general fund through ADVACs. So yes, a lot of community has expressed how much they want the program to continue and how helpful they think it is. So there is currently a lot of folks pushing to extend the program both through Give to SF and possibly the general fund.
Thank you so much, Chad. I don't see any further questions. We'll have DCYF come up next. Thank you.
Thank you.
Okay, we have, I think it's Sherrice from DCYF. If I said your name wrong, please correct me. Can you share with us Learning Hubs? Did I say your name right?
Yeah, you said it right.
Okay. Come on in, Sherrice.
Good afternoon, everyone. I'm Sherrice Dorsey-Smith, the Director of Programs and Grants with DCYF. And I'll be talking about the Community Hub Initiative. I see a lot of people, I recognize a lot of names, which either means I've been in the city for too long or I've been too many projects. So I'll just start. Let me share my screen. Okay, hopefully everybody can see. All right, so the Community Hubs Initiative, it has gone through a couple of iterations. We were known as the Community Learning Hubs at one point, and we've moved to the Community Hubs Initiative. The mayor on July 23rd, the mayor announced that we were launching these community learning hubs, and it was to support the youth with the highest needs. The quote that we've, that she says constantly shouting every time she gets in front of the public is that it'll take a village to address the wide range of learning needs for our city children and youth. during COVID-19, the pandemic, and the community hubs will provide a much needed resource for our most vulnerable students, which we all agree. So Community Hubs Initiative, I know folks are like, what is that? We've been hearing a lot about it. Some of you know, some of you don't. So Community Hubs Initiative is a neighborhood-based approach that we want to provide in-person supports for distance learning, that we want to continue to build on the social emotional well-being and development of young folks, that is staffed with youth development professionals, so our CBOs. We want to make sure that youth who don't have access to Wi-Fi, to equipment, in order for them to engage. We have so many youth that in the spring, and I'll go over some facts later, that the learning slide, it decreased significantly. We want to make sure that those young people don't slide even further, and that they're successful during this time. Phase 1 will start September 14th, that's on Monday, and hubs will operate Monday through Friday. So the hubs are designed to keep students safe from COVID-19. We've worked tirelessly to make sure that we're in alignment with the health and safety policies and practices that the Department of Public Health has come out with, as well as the California Department of Public Health. So all staff will have access to surveillance testing. So this is the CBO staff who will be working with the young people. Everyone will be screened for COVID-19 symptoms before they enter the hub. Masks will be worn at all times for everyone, except of course when they eat. They will stay in consistent small cohorts of 14 youth, for 2 adults to 14 youth, with no mixing between the groups. So there'll be stable cohorts. We won't have cohort A mixing with cohort B. 6 feet of distance will happen at all times between participants and staff, and we'll make sure regular cleaning and hand washing and sanitizing is happening. DCYF is providing all the PPE equipment for all the hubs, as well as all the cleaning supplies for all the hub sites through the duration that we have the hubs going. These hubs are designed and are for our most marginalized students. So we are fighting increasing disparities for our most marginalized students. So we are focused on residents of Hope SF, public housing and SRO, homeless students, foster youth, low-income households, English language learners, and through that, just with the intersectionality, we have our African American, Latinx, and Pacific Islander youth. So here's some statistics around just what was happening and what we know and why we wanted to implement these community hubs. So in the spring, Black and Native, Latinx, Latino and Latina, Pacific Islander, foster youth, homeless youth, special ed, and ELL students showed lower rates of online activity from their peers. We got this from the SFUSD Planning 2020 report. 30% of families reported that they did not have what they needed to support distance learning. Around 19% reported that they didn't have other resources that they needed. Research estimates that the COVID slide could cause elementary schoolers to lose 50% of their learning gains in math and 30% in reading. And then finally, the formation of pandemic pods by private citizens, threatens to leave behind families that cannot afford to join. So this reinforces why the need to have these community hubs in these neighborhoods for our most vulnerable youth is important. We can't continue to allow this to happen. We need to figure out and have interventions and strategies in order to support and stop this. So, folks, I want to know, what are the phases and how is outreach actually happening? So we're connecting to these disconnected and high needs communities with 3 phases of focused outreach. Our phase 1 are grades K through 6. And like I said, it'll launch on September 14th. And we have waves of bringing on more agencies through the rest of the month of September. So we have another group of agencies that will launch on the 21st and another group on the 28th, focusing on grades K-6. Phase 2 will have grades K through 12. So we'll be adding our 6th through 12th graders, and we'll continue with that expansion in phase 3. So for the focused outreach, for the initial wave, we've worked with our community-based organizations who are actually the ones who are standing up these hubs. They are our, what we're calling our CBO anchors, our lead agencies, to reach out to the eligible families. A lot of the CBOs, actually all the CBOs that we fund, work with this population already, and with CBOs being our main point of contact for youth on the ground, going through them to be able to reach out to eligible families, at least for this first wave, made the most sense as we are trying to work with the school district and other entities to identify youth that need and access to, are eligible and need access to a community learning hub. So community-based organizations are outreaching to eligible families in addition to our city partners. So we're also working with Hope SF, Human Service Agency, HSA, homelessness and sheltered, oh my goodness, I'm messing up their name. Homelessness, and supportive, oh my gosh, I feel so bad. Homelessness and supportive housing, kill me now. Homelessness and supportive housing to reach our students and, like I said, other CBOs. So they outreach to eligible families. Parents and guardians will complete a hub application either online or we have paper versions. So we have folks that are doing door-to-door, car-to-car, and RV parks that are trying to help families sign up, where they fill out the paper application and they come and the outreach person will enter it online. I've even accepted calls from families and parents and walked them through and typed in the information myself, just to make sure that they get their application in and they are able to get accepted. So they'll fill out an application. We review the applications based on the prioritized population and criteria that we have. And if eligible and there's enough space, which right now there is, we give them, they receive an acceptance notification that'll be sent and signed and had to come back with us. So it's a long process, especially for those who are with the paper applications, because we give them an application, they fill it out. We then have to go back to them so they can sign off on the acceptance form. This is what's going to allow programs to be able to serve their youth, as well as be able to, get information released from the school districts or whatever they have, so we can make sure that we have the most up-to-date information and can support them with their distance learning. So their login information, their codes, things like that. This is kind of where we are right now. As of September 1st, we have about 56 sites that have the capacity to serve 1,676 students. We'll bring on an additional 37 sites that can serve an additional 602, with a total of 93 sites and about 2,278 youth. Currently, we have about 80 plus CBOs who are on board. That represents approximately 371 CBO staff. And currently we have, as of this morning, 772 kids that are enrolled and assigned. And this map right here just kind of shows you where we are throughout the city. So the blue dots are our CBO sites that are operating hubs. The green are the rec and park sites that will have a hub. And then we have our libraries and public housing, and then a couple of other, these are entities that reached out to us and said, we want to offer our space because we feel that this is important. So we want to participate. And oops, really quick. That's the end of it. So, any questions? And let me stop sharing my screen. Yes, to do that. All right. So, oh, I see 21 comments in the chat.
Okay, we have a lot of chat questions, but I don't think it's none regarding you, but Uzuri put, the Potrero Hill Rec and Park are the only first responders for children. Uzuri, can you unmute yourself and elaborate to your question for me?
So the Potrero Rec Center just said that they're only taking children from first responders. The Potrero Neighborhood House is taking our children, but
Yeah, the Potrero Hill Rec Center, that's a site for the the ECYC. So
right. So
yeah,
our children do not go there, but the Potrero Neighborhood House
yes,
is the hub for our children.
yes, yes.
Because it's right there.
Great question. So I see your question, Tiffany. I'm gonna jump to Kent and I'm gonna go back to yours. Is there a site list of the hubs available? Because I know you listed it, but do you have the actual list of the ones that'll be approved and launching?
Yes, we're gonna actually, it'll be on our website hopefully by this afternoon, but I could probably share a list in this chat for folks to have.
And
Okay,
sure,
okay.
we always send out our materials after the talk, so we can also distribute if you have a printed list. We can.
Okay, I'll do that. I'll give it to you and you can send it.
Great.
Gotcha. And then Tiffany question is, how much interaction will the hubs have with the school, especially for students with IEPs and who have modifications and additional needs?
Right. So within our applications, we're asking families to identify if their youth have IEPs or special needs. And if they do identify that, we do a follow-up call just to make sure to understand exactly what's needed, like if they need additional assistance. Unfortunately, at this time, the SFUSD is not able to provide support in that regard. So this is where we're relying on our CBOs who do have who can be able to support youth with special needs or IEPs depending on the severity. This is us working and talking with parents to figure out, because we don't want to place a youth in a space where they can't receive the supports or the staff isn't equipped to be able to support the youth. So this is where we're working with parents to do that. The school district at this point in time, they're aware that we're getting requests from families to participate in the hubs who have IEPs, but they're not in a position to be able to support.
I'm looking, I don't see any hand raised or any other questions in the chat.
Let me say one more thing on the IEP. So I am working with an outside organization who is helping identify through their pool of folks who have experience working with youth with special needs and IEPs that we're going to use to be able to place into those hubs, or at least identify several throughout the different neighborhoods that depending on the number of folks that they can give me, but that's still in the works. But we're adamantly trying to figure out how we can support all the students.
Can I ask a question?
Sure.
Yes, go ahead.
This is Uzuri. So are you looking at substitute teachers that are like been furloughed, and substitute teachers to fill this void? Because
Yeah, so the organization that I'm working with is called Swing Education, and actually they work with substitute teachers, not necessarily, or teachers not associated with the district, but work with substitute teachers that they're based in San Francisco and they want to be able to help. So they're fundraising to be able to pay for those teachers to come into the hub. So that's the group that I'm working with to get that support.
And then we just have a statement saying, if you know what you said, San Francisco Unified School District, and I understand you're a DCYF, saying that it may be legally bound to provide IEP services and hold accountable. So what are you telling community when the district is saying they cannot? How are you guys pushing it back on the district, and who are you talking to, I guess, for those IEP specific questions?
I mean, it's exactly what I think was that Tiffany who posted that.
Yeah.
We are saying, well, the school district, you're the ones who actually can provide the support. So, you need to figure out how you can help us or what needs to be. We are pushing back. We've been pushing back since the beginning. And we've said, yes, we have some CBOs who are equipped and are able to support, you know, youth with special needs or youth with IEP, but that's not the norm across all. This falls into your realm. And so we're looking back to you to say, how can you help us support our students? So yes, we are pushing back and having conversation with them.
So real quick, over in Sunnydale, SCDC, Simone Community Development Center, has been operating at John McLaren. But because it's a unified school, technically, even though it's not a school, and they're already doing the great work over for the Sunnydale children of all ethnic backgrounds and all different ages, isn't there a way to cut through that red tape so that they can still, and they have the space to be able to distance, they have the staff, and then you have Drew and Larry who also can work with them as well, and they're also, is there a way to make that happen so that the kids have a safe space? Second part is for developers, they're building new buildings that have community rooms already in their building. Isn't there a way for them to also be a hub for the children that's already, only for the children that's in their building? That was a two-part, I know that's a lot.
Right, so for the first question, yes, we, you know, SCDC, the building that they're in, we are constantly trying to say, allow them to open. Unfortunately, that's falls on the school district. We've been pushing to say you need to allow them to open, but unfortunately we're not in a position that we can make that happen. All we can continue to do is advocate for that site to be open and to operate as a hub. For the community rooms and public housing, we are actually having hubs in Alice Griffith, Hunters View, directly in the housing developments in the community rooms, where youth who live there are able to attend the hub, where they literally just have to go across the street, upstairs, downstairs, depending on where their home is. So we are doing that in the spaces that we can. There is one for Potrero. We're still trying to secure that community room that's at, I believe, 1101 Connecticut. So we're hoping to get access to that as well.
Go ahead, Dr. Fuchs.
Yeah, Sherrice, thank you again so much for this. I just, one of the things we're encouraging is for families to come, you know, those kids who are going to be attending the community hubs to come and get tested and to take advantage of some of the testing sites that can accommodate children. Can you just share with folks what the plan is? And I'd be curious to hear, you know, in order to kind of get the word out about testing for families. And then I'd love to hear from others their ideas of how to encourage families to get tested, either through the community pop-ups or through the ATS sites or other ideas that they have. Sherrice, do you want to just say, in terms of the CBO partners, will they be able to encourage families to go get tested?
Yes, they can encourage families to go get tested. All the CBO staff will be tested prior to the start of the hubs. And then we are encouraging families and youth to get tested. We know we can't mandate it, but we're highly, highly encouraging them to get tested before they start.
And I'm curious if others have ideas about how we can encourage people to take advantage of testing, particularly before they start, but then even periodically throughout the time that the kids are participating in the hubs.
I mean, it's important to explain to parents that there are some places that under no circumstances, if their child is not tested, they're not going to let that child attend that learning hub. And so that's where you have to really just encourage and inform and enforce, because it's the protection of all the children. So yeah, because the ones I hear from, if you don't have a test, can't come through the doors.
That might be illegal too. So I know, like, and that goes for work sites. Like, that's one of the reasons. And we'll, like, if you have a positive test, we have a medical director from Dr. Tomas saying you do not need to come back and get a second test. I want to be mindful. It is 1:57, and I know Tiffany wanted to say a statement as a special ed mom to people that may be listening on how to advocate with the problem that has come up. Before I let, and then I want to just recognize Kenneth Kim saying about possibly Glide reserving testing days for families. So we will talk more to you about that. And Laura, I see funding. So Laura, after Tiffany, I'm just going to ask you to expand, and then you'll be our last comment. And then Mike, I'll let you ask your general question as we conclude. Who am I calling? Tiffany.
Hi, so this is for Sherrice and any other parent who is on the line. My daughter is in the 8th grade. She has now what is called an emergency learning plan, which is very specific to this virtual environment. I asked for it at the end of the last school year. And my guess is if you don't ask, they're not going to do it. But a part of her emergency learning plan is that her specialist has to provide 60 minutes or whatever the set of minutes you all as a team decide on of synchronous and asynchronous learning, which means that her learning specialist spends time either in a small group with other students with IEPs or with her individually, and also is required to sit in on her classes for some portion of the class so she is able to stay abreast. And then for parents or whoever the CBO representative, it really is important that you follow up with the specialist to make sure that they're doing it and try to get a schedule. That was the one thing that I really had to push for, was like, tell me when you're going to be there and when I can check in with you about how it's going.
Okay.
Thank
So
you.
they're able to, is she in another program where they're able to provide the supports with her in that program?
She's not.
Okay.
But that shouldn't matter.
Okay.
The teachers, they're legally bound. Once they have an IEP, they have to perform the service.
Mm-hmm.
And so I think parents need to just ask for the emergency learning plan to make sure that it includes that synchronous and asynchronous learning time for the student and the specialist.
And we are at time, and so I know I have 2 people to ask questions, so I ask people to give us maybe 3 minutes for Laura and then Mike to ask a general question. And then next week, we're gonna also work to get someone from the district, because I see we need a part 2 to this question, as well as I know we have some stuff opening up too, like museums and different stuff that'll also go with COVID. And then we'll be sharing out the health directive that requires no additional tests if you do test positive. So, no longer needed, Mike. Okay, I'll call you. And then Laura, can you expand on your question? Is it related to learning hubs before we conclude, Laura? Padilla, I think. She may be gone. Well, oh no, you're still here, Laura. Okay. Well, thank you all for coming, and we'll have the agenda out next Wednesday to share.
Thank you for joining the COVID-19 learning community. Any further questions, comments, or needs, please contact equity-neighborhoods@sfgov.org. Thank you and have a good weekend.
Thanks so much.